Okay, folks, Mr. Lane, you're good to go. And we have 50 people in the queue and ready to go.
Great. Well, welcome to the Managed Services in the Clinical Reading Environment webinar. I'm Jason Lane with Intelerad Medical Systems. I'm speaking today with a distinguished panel about a topic that is on top of mind for many radiology service providers, and that's managed services. But before I start, I'd like to introduce our panelist, Dr. Tucker.
Afternoon, Jason. It's nice to talk to you again. Thanks for having me on. My name is Scott Tucker, and I'm president of Radiology of Huntsville. I've been for going on 9 years now. We're a private practice radiology group centered in North Alabama, but also extending into Southern Tennessee. We've had a close working relationship in the managed services environment with Gene and Fineo Solutions and with Intelerad for the better part of a decade now. I look forward to discussing our pathway in the managed services environment and talking about some of the things that we've learned along the way. Thanks again for having me.
Fantastic. Gene?
Yeah, hey, Gene Cathy with Fineo. I'm CEO and founder of Fineo Solutions. We've been providing data management and workflow solutions for over 20 years now. And in particular, hosting radiology solutions since 2006. We have been reselling and hosting Intelerad for over 10 years now. We got hundreds of imaging facilities, hospitals, and numerous radiology groups of various sizes. And I look forward to the discussion today. Thanks, Jason.
Great. And Dr. Rosenthal.
Yeah, hey, everybody. I'm Trey Rosenthal. I'm president of Vulcan Imaging in Birmingham, Alabama. I've been with the group since 2001. I've been president for going on the 7th year now. We've worked with Fineo, which is the managed services solution, for about 5 to 6 years now. And really excited and happy to discuss this with everybody today. Thank you for being here.
All right, gentlemen, let's get started on our topic. So the first conversation, I'd like the two radiologists to talk about the challenges that they've experienced or perceived to experience with rolling out managed services across their reading environment. And Dr. Tucker, I'll direct the first answer to you.
Sure, I think I can speak to that to some degree. There certainly are challenges that you face. I think really the strongest challenge that you face happens early in the process, in the decision-making process itself. I think that all of us, be it individuals or as a group of individuals in a business group, have that tendency to not want to move forward, that natural tendency to resist change. And that certainly was the case for us when we started looking into working with a managed services company. I think that we overcame that natural hesitancy primarily because we knew that we wanted to be in charge of the flow of work. And we knew that if we could be in charge of that flow of work, it gave us a great opportunity to be more integral to the process of providing care in our community and to be a bigger part of the daily work of our physicians, our referring physicians, and the facilities that we serve. Also, we knew, quite frankly, and obviously, that we didn't have, as radiologists, the technical expertise or experience to do any of that on our own. So we knew that we were going to have to either hire in or outsource to get talented folks to do that for us. And we knew that it would be a daunting and ongoing process if we were to insource it. So we decided to look at finding or helping develop a company that could have the talents to do that for us. That's when our relationship with Fineo began. I think it's a relationship that's allowed us to not only become more productive and efficient in our work, but also to improve our contract security and our overall value to the system. I think that we certainly do add value to the system, and a lot of that is due to our involvement with Fineo.
Very good. Dr. Rosenthal, as a radiologist, I'm sure there were some clinical concerns that you had and some definite outcomes that you were hoping for and moving to cloud. Can you speak to some of those?
Yeah, so when we first started as a group, trying to convince the radiologists to go to something like this when PACS was provided by, by your hospital or by the place that you're reading for, when a PACS solution and a transcription or voice recognition system are provided, trying to convince everybody to actually start trying to somehow take control of this ourselves, which meant something out of pocket towards that endeavor, was a bit difficult. As we have stepped along that pathway, the radiologists have really seen the benefit of the efficiency that it's created in terms of report turnarounds, like to what Dr. Tucker was saying, turnaround times, towards the efficiencies it's created have been really, really good in the group.
At that time, I think y'all were reading out of multiple systems, right? A little bit more of a swivel chair radiology.
Yeah, so exactly. So if you can imagine sitting at that time, I think we were reading for 2 hospitals. We read for 5 now. And we were also reading for multiple sites. And if you can imagine having a PACS system to your left and to the center and to the right, and constantly having to check lists, maybe even having to log into a system, log out, log into another system, log out. That's where we were headed. And if you try to grow that model and that business, then you have more and more PACS systems that you have to try to maintain control over. And so and this was a gradual thing in our practice, by the way, but even like at first, we were going to put it with one hospital, but then we decided, well, maybe we need to do it with our outpatient situation first. But the less time that you have logging in and logging out, the more time that you spend just looking at one system just creates incredible efficiency. And for any group that's considering that, I've talked to a couple groups now. I know a lot of groups face those issues. And if you just started with that alone, the benefit would be is you won't be sorry that you made that choice.
Well, I could imagine when in a practice at your size, each radiologist having to take the additional time to move from one system to another, as opposed to just working out of one seamless system, probably gives you back a lot of time over the course of a man year. And I also imagine that it makes expansion a lot easier, right?
Yeah, absolutely. And I'll say even back to I'll add on to that just a little bit. So now literally most of our practice, actually all but just a very small amount of our practice, including all 5 hospitals on there. But at one point, just recently, our largest hospital is probably 30 or 40% of our practice. And we had virtually all the rest of our practice on a system like this. And so I thought, well, when we add the last hospital, which was a big chunk of our practice on there, we're only going to have marginal gains. The efficiency jumped like a whole nother level, to the point that like everybody commented on it. So like the more that you take that endeavor, the better.
And I know y'all been very successful with that. How many RADs are y'all up to at this point?
So we're, depending on how you count a RAD, probably between 20 and 25. It depends on how you count part-timers and employees and that kind of thing. But that's where we are. And so we've added many, I'll just say this, we've added many multiples of business with virtually adding almost no personnel because of efficiency.
And Dr. Tucker, before I move on, any other comments that you have about sort of from your perspective, what your concerns were as a radiologist?
I would like to add a little bit on to what Trey, I couldn't agree more with Trey. I think the power of unifying your work list is a magical thing. It really allows you to control your work list better, to prioritize what needs to be done better, to make sure that you're getting everything done in a more timely fashion. And I think it's important to remember, though, that just unifying the system doesn't really get the complete solution. You have to make 100% sure that your system, once unified, is designed, operated, and maintained by a provider that really understands radiology workflow and the importance of reliability and maintaining uptime and maximizing efficiencies and staying up with the technology and helping you to move forward as the technology progresses, because we've seen huge efficiency gains But we continue to make additional efficiency gains with new products that are added to the service line. So I think that we're continuing to make progress. We thought that we were going to make all of our efficiency gains early in the game, but we continue to make efficiency and productivity gains as we go along the process.
Yeah, if you're going to decide that reading studies is your core competency and technology is not, if you outsource to an entity, you better hope that they can do it a whole lot better than you and certainly understand your business well, which brings me to Gene. Gene, I mean, I just heard Dr. Tucker say understanding radiology. It's one thing to understand technology, but the application of the technology in a radiology setting is vitally important. You have any words to share with that?
Yeah, I do. Thanks, Jason. The workflow of a radiologist and Fineo focuses almost 100% of its time on making a radiologist more efficient and making sure that their workflow is that when new sites come on or new data comes into the system, it flows the exact same way as all other data. It also allows for them to divvy up the studies into the subspecialty reads where it needs to go, so that the doctors that have the best knowledge of reading a specific study is reading the study, so it improves the patient care. Knowing the radiology world, the amount of data that flows into the system, and to be quite honest, it's sometimes dirty data. It's not always clean data that flows through our medical systems. But knowing that and anticipating that is really what Fineo is really good at. And we have brought into our staff people not just that have the IT expertise, but the clinical expertise. I mean, we have people that most of our support folks are technologists, so they can speak the clinical side and the medical side just as they can the IT side. But again, every time that when Dr. Tucker or Dr. Rosenthal come to Fineo and say, hey, we're bringing on so-and-so site, we take it over from there and make sure that the data flows into their workflow. So lo and behold, one day when it's live, and sometimes it's very quick, their data just starts showing up in their work list for them to read.
Yep.
Yeah, and can I say one thing to that?
Absolutely.
Yeah. So I just, to think about it from a consumer's point of view, from an IT, like you could hire an IT guy to do this, and he's going to have to learn all these things. Whereas somebody like Gene's group, like Fineo, like what they're doing with the managed services organization, they do this across multiple systems, multiple PACS systems, multiple voice rec systems. Their knowledge and working base is far greater than you could ever possibly develop in-house on your own, because that's what they do day in and day out for a variety of institutions. So, and I will say this, without fail, what we bring to the table from an IT standpoint through Fineo and through this organization, to me, the level is always higher than what we're dealing with.
Certainly, when you have a managed service provider that has implemented many PACS systems in many settings and have gone through that journey, have that wisdom, have that gray hair and scar tissue, so to speak, that experience to help you lead the way, those best practices are just part of what you're buying, part of the value of that service. Mm-hmm. Gene, I'd like to give you a few more minutes just to talk about some of those best practices that you bring to the table for managed service clients.
Yeah. Well, one of the things, again, go back to the workflow, understanding the data, the type of data, how that data flows. And at Fineo, we just don't focus on the application, but we look at the infrastructure that's needed to support that data and to support the workflow for the radiologist. You hear me say workflow a lot, because that, to me, is one of the most important things is keeping a radiologist reading studies and providing patient care. But knowing the data, knowing the architecture of how a radiology and medical system, flows. Where does the order come from? Where are the results of the ORU? Where does all that data need to flow? But before you start implementing, so that you're prepared for that ahead of time, and having the experience and radiology data is big footprint data, and I mentioned this earlier about like bringing on the tomosynthesis in the mammo world. That's big footprint data, and you need to know that ahead of time before you start trying to implement a solution. And then again, with Intelerad's architecture, its ability to allow you to move data and to put data where the viewing is happening. It's one of the reasons Fineo chose to be a reseller of Intelerad was the architecture and the flexibility of that architecture makes it very nice in being able to architect solutions that fit the radiologist needs. And again, radiologist needs, depending on the size of the group, can vary drastically, but they all have a similar workflow. But each one will have something unique about it. And at Fineo, with our IT background, our background is corporate. We spend a lot of time in the corporate world doing workflows for the Fortune 10 companies in our past history. So that's nice experience, or I like to call scar tissue, to have to pull from, because many times the data is medical data, but it's the same as engineering data. It's the same as nuclear reg data, and knowing those workflows in the past and how to do that really helps us architect a solution that fits the radiology group that's cost effective too.
Absolutely. I would second that for sure. It's not only do you have to know the technology side, have a really good system, have a well-oiled machine that's running and highly reliable and redundant, is very secure. It's about how to apply all that knowledge in the radiology setting, how to lace all the technologies and the applications together to make them run smoothly and to keep the doctors happy and productive. Along those lines, you have any thoughts on the total cost of ownership differences between an in-house on-prem solution versus going to the cloud?
Yeah, we've got experience with both. The on-premises hardware, the initial layout's probably a little less expensive than if you're going to a cloud-based solution. Although if you go with a managed services company that's already hosting a solution, many times the hardware's in place so that the wealth of the cost can be spread across multiple customers. And that's the beauty of the cloud, is that a lot of the work has already been done. So total cost of ownership from the cloud, to me, at least what I have seen, has been somewhat less expensive. And then if you take into consideration the IT services or the IT personnel that you no longer need, or you don't have to hire to support your system, the managed services and the cloud offerings is much less expensive in that standpoint. And to be honest, you get to move into a per study, or more of a get away from the capital expenditure and be more of an operational expenditure. So like during that, like we've seen this year, you've seen volumes, especially in March, April, and May, really take a dip. When if you had a capital expenditure, or if you're leasing equipment or leasing a system, boom, now you've got to keep paying that. But as you're paying a per study fee, as your volume drops due to COVID, so do your costs drop. So that model kind of really helps facilities be able to stay in business, to be blunt. We saw, some significant drops in some of the facilities, but, we just only charge a per study fee. So that really helped in that instance, and moved to more of an operational. And move the cost as you add business. You move the cost to when that business is actually being recognized, right? So you're not paying for it up front. It's not the field of dreams. If I build it, they will come kind of thing. It's, hey, I'm gonna build it as I'm getting the business. So your revenues offset the cost. Because again, many times these are radiology groups that are not used to paying for a PAC system, are now paying for it. So you better be seeing revenue for something I'm paying for as you move forward.
That's right. My experience has been that the financial model that aligns the IT expense with the business revenue makes a lot of sense. And in the situation that, we've just seen with COVID, where your volumes are reduced, your expenses reduce, and that's just not the case in the capital model. In the capital model, you bought it, the expense stays. It doesn't matter what your business is doing. And then you're repeating those large capital investments every 3 to 4 years. And then the ease, back to Dr. Rosenthal's comment on the expansion piece of this, is when you just need to add another facility, how easy is it to look at your fee per study and go, oh, they have X volume, They have X number of sites that we need to connect to. Our expense to bring on this relationship is this. It's very easy to understand what your cost basis is and to do a pro forma whenever you're adding your business and your expenses are aligned with the additional revenue. Likewise, if you're offboarding a client, you know exactly what your costs are going to be to pull them off your system, right? And so it's definitely advantageous in that regard.
And it really
there's
is.
no-
I can speak to that just a little bit. It really is advantageous to us strategically to know that going into any negotiation that we have when we're trying to onboard a new site. We don't have to worry at all about the IT side of things, and that takes a lot of the pressure off. And we know exactly what we need to do. And when we land something, we just tell Gene, go, and it happens. And that is a huge headache off of us.
Yeah. And there's no problem. There's no becoming familiar with a new system. It just, the work just shows up. And now you just have more studies on something that you already do and know really, really well. It is so streamlined.
One last observation that I've seen, even when on the smaller end, the total cost of ownership is typically going to be more expensive to do it yourself because you have to invest in at least that one full-time IT person that doesn't even give you double coverage, obviously, but that investment alone oftentimes is the same expense as what Fineo would offer their entire managed services that included all the equipment and the underlying systems. And I just lost my train of thought on the other point I had there. Sorry about that. So anyway, moving on, let's go to topic number 3. When it comes to sort of the business strategy of implementing a managed service solution, Gene, I'd like to start with you, and then we'll move to the doctors to discuss this topic.
Yeah. It's the business strategy, especially if it's a radiology group that's looking to control their own destiny and be able to make sure that the practice is being as efficient and allowed to grow as it wants to. That's huge in their decision to move forward and be able, like I said, be able to grow and control it. When I'm able to control their own destiny is basically moving to a single reading environment that allows them to, again, add sites at will almost. They literally can look for business, look to grow their footprint. And I'll speak specifically about the Vulcan Group. The Vulcan Group started out being primarily in the Birmingham area, and now they're spread out to much of South Alabama and over even into Georgia. So their footprint has grown drastically over the last couple of years. So having a business strategy, if you want to grow your practice and you want to also build a moat, if you will, around your existing practices, so that you can protect your existing contracts, it's huge to have a technical company, a managed services company that can provide that kind of solution. The referring physicians in the Birmingham and other areas, Birmingham and Huntsville areas, are so tied to the radiologist and the solution that's provided. We used a Teleconnect product with a little Fineo magic behind the scenes to make it even a little more attractive. But the referring docs actually use the solution provided by the radiologist in their clinic on a day-to-day basis at many of the orthopedic groups and spine groups. And that's huge because you have immediate value as a radiology group back to your customer, which is referring physicians. So yeah, it's important to have a company again that has the experience of scar tissue that's been through most every situation. And you always got to tie back to all the systems that exist out there. I don't know if there's an EMR that we haven't tied to. There may be. But then we've tied to the big ones, the Epics, the Cerners, the CPSIs of the world. So being able to do that, again, make it seamless, not just for the radiologists, but for the consumers of the data downstream. It's very important that they be able to get to that data too. Again, ultimately, this is all for patient care, to improve patient care and to use the technology to improve the flow of information through the radiology and medical world.
Right. And I remembered what I was going to say, and it sort of ties into where you were headed with this, is that even if the costs are similar or slightly more, for a radiology practice to not have to be distracted with the mundane and the practical and the delivery of the technology, just the divesting of the headache and to be able to focus on what they do best provides additional return on investment. And what I've really enjoyed about y'all's particular situation is how much so that's occurred for Dr. Tucker and Dr. Rosenthal and what y'all have seen in your practice. So much so that I've learned that many RADs who were sort of a naysayer of moving to the cloud early on have become great believers, and you couldn't convince them to go back to a different world. So Dr. Tucker, I'll start with you. I'd like to hear more about post the decision, what has happened within the practice. Go ahead, Gene.
Can I jump in here real quick? Because I want to say this, and it's not like that Fineo just magically comes up with these ideas in our head. I mean, we do think outside the box. But you brought up a good point in that our relationship with the radiology groups, if they see a situation where they're having to look for information, or as we get told, it takes extra clicks, they let us know and let us know how it's affecting the workflow. And I know Dr. Tucker may smile, just there's one doctor will actually go down and figure, hey, this takes me extra 15 seconds, blah, blah, blah per case or something. And actually will send back to us, this is how much it's costing us. And that's really great information because it allows us to be innovative in how we adjust our workflow and the radiologist workflow to try to eliminate those clicks and eliminate those delays. And Dr. Tucker knows what I'm talking about, but we appreciate that. That helps us be better too.
Absolutely. And I spoke to that a little bit earlier. I think we're continuing to gain efficiencies. We gained a great deal of efficiency at startup. But as we've added more to the system and as we've learned our way around it more, and as you've helped streamline it, we've continued to gain efficiencies, and that just adds to our bottom line. And so that's what we need. First, speaking a little bit to return on investment, first and foremost, obviously we're doctors and we have to provide care to our patients and maintain that service, and we need the system to do that above all else. But when it gets right down to it, we're also a business entity. All of us are part of a group, and being a good steward of our money for those of us that are in administrative positions is something that we take very seriously, and we require a return on investment for any capital outlay that we make, and the managed services contract is not immune to that requirement. I can honestly say without hesitation that our relationship with this managed service provider, Fineo, and on the Intelerad platform has had an abundant return on our investment. Just a few areas to speak to quickly: contract security, ease of growth, and recruiting advantages. As to contract security, as Gene mentioned, with the IntelliConnect system, we know we have some of our neurosurgeons that will view their images across the dinner table, rather than having to go log in somewhere and go to a hospital or go to their office, and that matters. And our oncologists use that same app during their clinic workday, and that matters. So we become part of the system, and we become something of value. We add value to the system rather than just being a commodity reading films, and that really matters in our world. Two, ease of growth. Trey mentioned earlier, it really is plug and play. If we see an opportunity, we don't have to worry about the IT side of it. It gets added in. It just shows up on our list. It's in our normal workflow. We get it to the people that can best read it for us most efficiently and accurately and effectively. And it just becomes part of our workday, and we add it to our bottom line. And three, in recruiting, that's really important to us right now. Those of us that deal with recruiting on a if not daily, weekly basis, it's becoming harder and harder to get good talent into your group. Radiologists are difficult to come by, particularly if you're looking for one in a specific area. Nothing turns off a new radiologist, particularly good, bad, or indifferent, the younger radiologist, than an IT train wreck. They walk into 5 workstations and that are all not interconnected and working independently of one another, and you don't know how to log in on this one or what voice recognition's on that one. They'll leave. They won't even consider your group. it really is a recruiting advantage to have it all tied up and unified. Not to mention the fact that our productivity and efficiencies allow us to increase our percentile in income, and to make sure that our lifestyle stays where it is and we have adequate time off. And it's those limitations of windshield time and improving our productivity and efficiency and making sure that our lifestyle stays where it is that really allow us to effectively recruit and continue to grow. We're in the process of adding typically 3 to 6 rads a year is pretty much what we're have been doing over the past several years. I could go on and on. That there's so many things that being a part of that system does for us, from meaningful turnaround times that helps protect you, and also provides value to the hospital. The ORU flow, the HL7 connections, the connection to our billing system, real-time RVU tracking has been incredibly valuable for us. How we're going to participate in clinical decision support, how we keep up with MIPS, all of those sort of things. Really, we do better because we have someone managing our services in the cloud environment. So it's really been unbelievably good for us regarding return on investment.
Yeah, it sounds like you got a whole bunch of time back, and the group asks yourself, how can we run a smarter business now that we don't have to focus on the technology delivery? And what you did with that time and that intellectual thought has produced some tools, some KPIs, some good processes that really have brought the return on investment of going to managed services out in a very beneficial way. Dr. Rosenthal, you have anything to add to that conversation?
I would echo all those things that Dr. Tucker said, because that has exactly been the case with us. And I thought of a good way to paint a picture about this. So the things that kind of used to define where we would sit a radiologist before would be like, for instance, if we're going to put a radiologist at a hospital, how many studies is he going to have to be reading at that hospital? Are we going to need 2 radiologists there? How many procedures are they doing? Those types of things. Well, now imagine that wherever a radiologist sits, they can see our entire practice. So no longer does the amount of studies that one place is generating have to determine how we staff that place. What determines how we have to staff that place might be contrast coverage. It might be procedures that are going on there, but we like to provide subspecialty reads, like for instance, neuroradiology trained people read the neuro studies, that type of thing. Well, no matter where we put a neuroradiologist, he can see the entire neuro volume of our practice. And so that can be from any location, and that can be even from home. We have workstations at home for all our radiologists. So to have that ability to plan, it just provides a whole nother level of strategy that we could not conceive of before we were doing something like this. So I just wanted to throw that on top of what Dr. Tucker said.
And to add to a couple other things, we do track turnaround times for the radiologist and provide that on a monthly basis. And these are true turnaround times for radiologists. It's tracking the time when a study is placed on the RAD work list to a signed report. And this has been beneficial, I know, in particular for the Vulcan group when negotiating contracts, because some of the contracts turnaround times are based upon when a study is ordered versus when a radiologist actually has the study to read. And that can be very tough to meet when the radiologist has no control of the ordering or getting the patient back and getting them through the MRI or CT, whatever modality they're going through. But what we do is we take it from the time it's placed on the work list to assigned date time. And I know that several facilities with the Vulcan now, that is a turnaround time based upon what we provide on the work list placement.
Yeah, we actually had that issue come up a couple of times where the turnaround times by the hospital that we serve said, hey, these are kind of long. And we were able to show them, well, when the study hit our list to the time we got it, our stat turnaround times across our practice, 365, 24/7 on stats is like 17 minutes right now. That's all comers, all times of day and night. And so we were able to show them that. And then because of what Gene does behind the scenes, we can also show them show them where some of the delays might be occurring from their side. And they are very, very appreciative of that.
They really are. I agree completely. When the first thing that a hospital administrator or an ER physician, for that matter, that they think of when there's a delay in getting a result from a radiology procedure is that the radiologist wasn't available or didn't read it quick enough. And more often than not, that's not actually the limiting factor. And the hospitals actually appreciate it when you can help delineate that for them, and show what your true turnaround time is and where the other issues may have been. And those sort of things are good interactions with hospitals.
And I'm very impressed with what Fineo has done in particular, because we talked about again and again the value of having the radiology experience, the workflow experience. It's the application of technology in the radiology setting that's so important. So the private radiology cloud has great value for any radiology or hospital group. But the fact that Fineo has rolled up their sleeves and got so involved in listening to their clients and hearing what the needs of the RADs are to say, how can we take this to another level? And y'all have co-developed these additional applications together that allow y'all to work smarter. That's incredible. I don't know where else that you can get that. So I really commend you and Gene on what you're doing there on that front. All right, we have, well, before we wrap up this topic, we got about 5 more minutes before we need to get to several of these questions out there. I'll open this up. Dr. Tucker, Gene, Dr. Rosenthal, is there anything else that comes to mind in this particular topic that we can share to our audience you feel might be helpful in making the decision to go to managed services?
Yeah, go ahead.
I'm sorry, Dr. Rosenthal. I was going to add on that we haven't crossed the goal line and spiked the ball yet, because as the industry continues to evolve, we have to continue to evolve. And so like Dr. Tucker mentioned before, clinical decision support, radiation dose tracking, and now AI, as AI comes more and more into the radiology world, how that flows into a radiologist workflow is key. Some really cool AI tools and that kind of thing. What we at Fineo are looking to help with is make sure that information that comes from AI flows into a workflow so it does not jeopardize the radiologist or slow a radiologist down. We want it to improve the workflow, not hinder the workflow. So that's one of the things that we are. I'm working with both of these groups right now on AI, possible AI solutions, and that's one of the things that we look at is how it flows into their existing workflow.
The only other thing that I would add is that we talked a little bit about turnaround times, and I can't tell you how much of an advantage it is for us to provide that sort of information to the facility rather than it being the other direction. We let them know on a monthly basis what our turnaround times are, and it really is a canary in the coal mine sort of a situation. If we see our stat turnaround time go from 11 minutes to 16 minutes or 18 minutes, we're still well within our windows and well within our contractual obligations. But it lets us know that something's going on that we may need to address. Maybe we need to add an extra hour onto the end of this shift, or look at our manpower staffing here or there, or moving this around. And we have more strategic information about how to run our practice than we ever had before. And it really is helpful.
Yeah, I'll echo that completely. We have found that to be exactly the case. Like we can shift, we know how to to tweak the shifts to meet the demand, and we can actually watch the demand far better than we ever could before, which echoes that exactly. And I just also wanted to add just the level of IT competence that comes to the table in any of these discussions, not only the competence, but also how Gene handles himself, how the people that work at Fineo handle themselves. They have done just an excellent job. And even to the point where like they sometimes help the places we serve with what they're doing. Like they can point out some things to help them with their side of the world. And that's happened on some occasions as well. So we have just been really, really happy with what Gene and Fineo are doing.
And to underscore, the application that helps you understand what your turnaround times are per provider and all the other intelligence that it gives you wouldn't matter if you didn't have a well-designed, well-run system that was fast, that was optimized, that has all the workflow intelligence that Gene and company brings to the table to make sure that large amount of studies are moving all over the place quickly and are there, available, including the priors ready for the radiologist to read. And so at the end of the day, having that system, having that faith in the system that day in and day out, it's just going to work for you and it's going to be there 24/7. It's got to be a big relief for the RADs and not having to worry about those things. Maybe even to the point that perhaps today y'all are now taking it for granted of, hey, life is great. We haven't been down and I don't know when, that the system's always fast and is optimized, and we're growing on top of that. All right, so we have about 15 minutes. We've got some questions that are pouring in. Let me tee those up. I think, well, actually both doctors had talked about how these technology tool sets and the automation have really benefited the radiologist and have made recruiting better and easier as a result of being on the latest and greatest and having the competitive advantages. Do y'all actually go so far as to try to market that as one of the reasons to attract radiologists to come for? And if so, can you speak a little bit about that?
Yeah, I can start with that. We most definitely do. We bring folks on typically on their first interview. We bring them on site after we've talked on the phone and made sure there was something that we were wanting to seriously consider from both directions. We bring folks on site and show them our system and show them how we work on a daily basis and show them how our workflow works. And typically we'll introduce them to Gene or Eric or one of his guys and let them see that we have a direct relationship with our workflow provider. And that matters because, you know, when it is technology, and I'm not trying to shoot rainbows out everywhere, there are things that go wrong with any technology. The great thing about this is that when something goes wrong, I know who to contact, and I know that I'll get an immediate response and that it will be fixed, as opposed to reaching out to a random IT person at a facility that I haven't talked to in 3 years until there's a problem. And then I don't know what's going to happen. So we show those things to prospective RADs. Absolutely. It's a real and legitimate selling point.
And do you find that the younger radiologists have even greater expectation of this automation as opposed to the older radiologists that you required?
Trey, you're an older radiologist. I'll take that one.
I will say that the younger generation has a much easier time adapting. That has been our experience in our practice. Not that the older, the more seasoned radiologists haven't adapted, because they have. But I would say that the younger people coming in, they're more tech savvy just in general because of all the stuff that's going on in the world. And in terms of recruiting, it's sort of the same situation for us. Being able to show what we do and how we do it, it always leaves an impression on somebody. And it says that you're serious about what you're trying to deliver from a value and a business standpoint, value for your patients and your referring physicians and what you're trying to do as a practice. I think it sells even on that kind of that level. So, well,
yeah, you're right. It shows you're investing in your practice. You're wanting to make your company a great place to work. And you're also showing I think an attitude of service and wanting to provide the best service for your clients. It should resonate in both areas. All right, so the next question I have here, and this would be for you, Gene. What does a typical system onboarding process look like, just sort of in terms of timeline? Are we talking about, your typical months where you have to go out and have a bill of materials where you buy the gear and you have to wait for it to ship, and then you take it to your data center and you rack it and stack it, and then you start adding software, or is it something much shorter than that?
And I hate to give you the answer, it depends, but it does depend upon the size of the facility that's coming on and what it takes. If it's an outpatient center, I think Dr. Rosenthal had mentioned this before, we've brought outpatient centers on in just a week or so. and it depends upon if they have an IT staff, can they spell VPN, that kind of thing, all plays into the discussion. When you talk about a hospital of size, there's always the security pieces you have to go through and be vetted, and that usually takes some time. But generally speaking, you're looking at 4 weeks to up to 3 months, and it depends upon the size of the facility's willingness. You walk into a hospital, the very first thing the IT group says is no. Always. And then you have to walk through that you are secure. You do know what you're talking about from the radiology workflow. And then you start seeing things really start moving very quickly to the point that the ER docs just quit using the in-house system and will use the Fineo system, especially for providing an overlay, which basically means that we're overlaying an internal PACS system and ordering system, and then we interface so it's seamless. The results are seamless down the workflow, so that the radiologist can read on our solution. No one downstream knows that, and you start seeing that happen more and more because, again, it's improved patient care. It's immediate access to a radiologist. I mean, there's things that we don't talk about that we take for granted. To be honest, the Intelerad instant messaging capability between an ER doc and a radiologist is right there, and they can talk directly to them. The tech no longer has to pick up the phone and try to find a radiologist. They go to instant messaging and talk direct to the radiologist. If a radiologist wants to share a study with another radiologist that may be better at looking at ankles, well, they can just send that link directly to that doc and have them look at it, and they can collaborate on it. We take those tools for granted, but we shouldn't. They're really cool tools that have been provided through the Intelerad platform that make patient care and collaboration with doctors and with the technical and medical staff very seamless.
Right. I mean, you're obviously going to have third-party timelines that you're going to have to consider your client's ability to focus on getting the project done, their clients, their hospital's ability. But in terms of just deploying the system, when they come to the cloud, the way you got set up is pretty much you press a button and their environment is live, and now you start the software installation. You don't have to worry about procurement and where the hardware is going to come from and how COVID is affecting shipment timelines and so forth. So it definitely does speed it up, and that's very impressive what you talked about in getting that one facility live.
Yeah.
All right, next question. Here's a couple that I can answer. Does Fineo charge? How does Fineo charge for the service? And it's largely variable costs on a fee per study, whether it's voice rec or it's the PACS system, correct?
Yes, that's correct.
All right. Another question is that does Fineo use the Intelerad Radius platform? And the answer is no. They have their own platform and their own systems.
We're not opposed from using that data center. I mean, we've talked about linking them together at times.
Right. Next question. How do you track and report RVUs for your groups? And is it live data that you're looking at, or is it more over time, like at the end of a month?
I speak to that. We have live tracking all day, every day, 24/7, 365. That's and we had long and detailed discussions about how we wanted to present that data to members of the group. We decided to have it be absolutely wide open. So you know what your productivity is for the day, you know what everybody else's productivity is for the day. And we don't use it as a punitive, punitive in any way, or as a payment measure in any way. We use it to let everyone know where they stand. And we saw, just putting that into place, we saw immediate improvements in productivity. Just knowing that it's there, and the internal competitiveness that we all have, getting to where we are in life, you pay more attention, and we establish benchmarks for each of our different rotations. You may be on a rotation that's heavy in fluoro or heavy in minor procedures, and your productivity is going to be considerably less than, say, an MSK doc who has, their pick of 100 joints to read. So productivity benchmarks differ rotation to rotation, and we look at those cumulatively, typically quarterly, to kind of see. And again, it's canary in the coal mine sort of stuff. We don't use them as a punitive measure, but if somebody is having issues with their productivity, typically something's going on. We need to look into it and see what's going on with that individual and help them through whatever they're going through, whether it be burnout issues or something at home or whatever it is, or just not liking the type of rotation they've been on. Whatever it is, we do have real-time live tracking, and we compare that to our business office hardware, software as well. And it's actually very accurate. The interventional service is difficult. Tracking interventional procedures is harder, live, real time. But other than that, it's well into the 90s percentile, percentage-wise accurate to our true business office RVU data.
Okay.
Yeah, I think one thing to add on to the RVU tracking, it is real time. It's a speedometer. It is, you literally are looking where you're at right now on a day-to-day basis. And it's a graphical interface that changes colors as you get closer to your 100%. But it is a speedometer. So, it's taking real-time data. It is not sifted data like billing data is. But it does show, I think with radiology functional, we're somewhere north of 95% compared to, when you go back and compare to what the billing data is that's been sifted. So it is a really, really good speedometer. I don't want to say the percentage increase, but I have measured the productivity of the radiologist, and it's significant.
All right, we have a few more questions. Let's see if we can. Oh, go ahead.
I was just going to add one more quick thing on that. We have almost exactly the same experience as Radiology of Huntsville on that. Even to the point, there was much consternation initially when we talked about putting out this daytime tracker. A lot of resistance, a lot of like, what are you going to do with this? You're going to be watching me, everything I do, that kind of thing. And then we decided at one point to pull it back, to take it out. And then we got people saying, hey, I actually like it because it kind of helps motivate me throughout the day. So now we're in the same boat exactly as what Scott said. We watch it real time during the day, and it's definitely helping across the board with productivity. So.
Got one question here I think I can answer. Does the managed service or cloud system support mobility, reading from home, extended offices? I can take that one. The answer is definitely. The whole point is read anywhere at any time. In fact, I have just a little study to emphasize this. So we got a call into our support desk. This is a few years ago, actually, where the doctor was just complaining when the call hit the support desk. My system is slow. I can't get this study done, blah, blah, blah. And we're thinking this is very unusual, normally not, the call we're getting from our clients. And as we dug in about 30 seconds, we realized that the doctor was reading the exam on an airplane. And the fact that he could even do that was astounding to us. Like that he could even attempt to even partially get through this and think it was possible. So that was actually turned into obviously a really good case study in what is and what probably could be, as technology continues to evolve down the road.
Yeah. If it's an MRI, you might can do it. If it's a TOMO, forget it.
Our experience is not quite as impressive as that, but I can say that we read all of our own stuff 24/7, 365, and have our own night guys and gals. And we have every night we have on-site and off-site staff. So each and every night we have at least one person that's reading off-site throughout the night. At 3 a.m. we've got somebody reading from somewhere else in the country.
Good deal. This last question, Gene, I'm going to target it towards you. It says, does Fineo provide an SLA, which means service level agreement, to the groups that they serve?
We do through the agreements that we have with them. And knock on wood, we really haven't had any case where we have not met those. But we do on some, but we haven't on all, to be honest. It depends upon the groups. And the fact that we were really early on in being able to host these solutions. We may have been one of the first, if not the first, to host Intelerad in the States, especially to offer it to multiple radiology groups. And I know we definitely were the first to host a PowerScribe 360 to multiple radiology groups. So So a lot of it was that we had early adopters of that that did not require an SLA, but we do have SLAs and can provide those.
Fantastic. Well, that brings us to the end of our webinar. I want to thank everybody for joining today. I especially want to thank our panelists, Dr. Tucker, Gene, Dr. Rosenthal, for participating in today's session. And if you have any questions at all, please email us and we'll be happy to follow up. Gentlemen, have a great rest of your day.
Thanks, doctors. Thanks, Jason.
Bye-bye.
Bye-bye.
Thank you.